DPI. This stands for dry powder inhaler. So, I would say that if you have asthma or COPD, you are on one of these. The reason that I predict that is because these are considered maintenance medications or controller medications. Now, a lot of times with these, people don't realize how important they are because unlike rescue inhalers, you don't really feel these working for you, but they're super important, and that's because they control the underlying inflammation in your chest. Now, why is that important? It's important because inflammation in your lungs is going to cause irritation, it's going to cause your airways to get smaller just because they're inflamed and swollen, and inflammation increases the amount of mucus that you have. So it's very important. Also, with the dry powder inhaler, it takes 4 to 6 weeks before you even start noticing a difference with it. Okay. I have had so many people come to me and say they stopped taking it because they couldn't tell a difference. It's like I said, it's something that will be gradual and you're not going to notice it really well until you stop taking it for a month. Okay. So these work very, very well at controlling symptoms. So I highly recommend that if you're somebody who started taking it and then stopped for one reason or another, talk to your healthcare provider about getting back on one because it is very important. I actually think that they are just as important as the rescue inhalers. So for the dry powder inhaler, most of the time, these are something that you're actually going to load the dose that you're getting ready to take. Um, they can come in a pill form that you manually put in. It can already come with all of the doses in it, and you just click it. And then it can also be something that you just push a button and it goes. Okay, so there are different forms of the dry powder inhalers, but you take them all the same way. Now, what you want to do is you make sure that you're breathing all the way out before you take it. So you'll breathe out. Then you're going to either click or push. Once you inhale it in, you hold it for 10 seconds. Controlled exhalation. Once you do that, you want to rinse your mouth out. Majority of dry powder inhalers do have inhaled steroids in them, so very important to rinse your mouth out after you take them. So there you have it. That's a dry powder inhaler in a nutshell. Um, don't overlook it. Don't stop taking it if you have one prescribed for you. And if you feel like whatever you're on isn't working, there are so many to choose from. Some work better than others on different people. So it might be something that you have to try a couple of them to see which one you really like. But they do take about 4 to 6 weeks before you start noticing a difference once you start one. Um, but other than that, hopefully this helps you out a little bit when you're trying to maximize your medications.